Hi everyone, it's Dr. Chi. Welcome to another episode of In Good Hands with Dr. Chi. Today we're going to be talking about Dupuytren's contracture. Dupuytren's contracture is a type of disease that can limit the use of your hand. It happens when certain tissues in your hand thickens and then eventually force the finger to starting to contract down. It's going to make it difficult for you to open your hand, so it's quite debilitating in people with Dupuytren's contracture. Dupuytren's contractures are mostly commonly found in people with Northern European descent. For example, Sweden, Ireland. However, we see patients in all ethnicities that could also have Dupuytren's contracture. Most commonly, they exist in patients in their 50s to 60s, a little more common in men, but it also happens in women. In the beginning, the Dupuytren's contracture can start very slow and very insidiously. Usually, patients will feel a lump in the middle of their palm. Usually, it's in this area. Most commonly involve the ring finger followed by the small finger. So when the Dupuytren's tissue is starting to thicken, it starts with a lump in the palm. Now, usually, it's called a nodule. So a nodule is starting to grow, and slowly over years or months, the nodule can start to form a cord. So this happens when multiple nodules kind of connect together to form the Dupuytren's cord. As time continues, then the cord will cause eventual finger contracture. So that means your finger is going down and then it's hard for you to straighten them. Usually, this does not happen overnight. It happens gradually, and that's why sometimes the patient seek help quite late because it's been going on for a long time. So what do we do when someone has Dupuytren's contracture? Well, depending on how severe it is. If you have a very mild Dupuytren's contracture, you might not need to have anything done. There's a really good way to tell whether you need something to be done for Dupuytren's contracture. It's called tabletop test, which means that to see whether you can flatten your hand completely on the tabletop. For example, if you can put your hand completely flat on the tabletop, you probably don't really need to have surgery done or have anything done, even though if you have a cord or a nodule. If your finger is starting to contract and you cannot flatten your hand, that's time to seek a hand surgeon. The treatment or the most effective treatment or the gold standard treatment is surgery for Dupuytren's contracture. Although surgery treatment is the only effective and gold standard treatment for Dupuytren's contracture, there's also other treatment that's currently not used as well or not recommended as well. However, many of my patients that comes in also ask me about these treatments, so I want to go over those with you. Other than the Dupuytren surgery treatment, there is a type of injection. These are usually collagenase injections. What that is a type of chemical, which is an enzyme that dissolves collagen. So what happens when you inject it into the hand, into the Dupuytren's cord, the enzyme can dissolve the cord partially. And then the patient comes in 24 to 48 hours later and underwent a manipulation, which means just forcefully straighten your finger to see if we can break the residual cord. And that treatment is effective, especially someone who is, really too sick to undergo surgery. That occasionally the cord can snap and then they can gain some function. The issue with these type of treatment is recurrence rate is extremely high, and once it reoccurs, it forms even more scar tissue, which means it makes the subsequent corrective surgery much more difficult and a lot more riskier. There's another type of treatment. It's called a needle epineuritis. Surgeons use a large bore needle and use the tip of the needle as a small knife to cut the cord and snap the finger straight. As you can see that similarly, because the Dupuytren's material or that abnormal material is not taken out, the recurrence rate is high. And again, once it reoccurs, it makes the subsequent surgery more difficult. There are also other type of treatments such as radiation to the hand. Usually has a very limited success, and it's not very well studied at this time. This is the end of part 1 of Dupuytren's contracture. Make sure to stay for part 2, where we're going to be talking about the surgical treatment of Dupuytren's.